It is said that the good physician treats the disease, the great physician treats the patient who has the disease. With that, we begin today's session on Wiki Presents Health and Wellness Forum with our lovely and stunning moderator, Dr. Shilpa Bansal Chavan. And we have our today's guest speaker, Dr. Pranav Agarwal ji. So let me introduce Dr. Pranav Agarwal to you all. He is a consultant orthopedic and adult joint reconstruction surgeon representing Lilavati Hospital and Research Center. He is MS GNB orthopedic surgery. He has earned a fellowship in computer and robot assisted knee and hip surgery from South Korea and Mumbai. Having obtained his postgraduate degree in orthopedic surgery from Mumbai University, he pursued fellowship in knee and hip surgery, including total partial hip and knee replacement in Mumbai and South Korea, which was sponsored by University of California, Irvine. He practices at various prominent hospitals in western suburbs from Bandra to Kandivali, including the prestigious hospital Lilavati Hospital in Bandra, and treats patients globally using latest communication technology. He has a passion for research and technology in surgery, and his research interests include orthoscopic ACL reconstruction, which is common known as easily understood as minimum invasive surgery technology, navigation with the help of computer assisted knee replacement and robotic in joint replacement surgery. His research is published in reputed journals across pan India, and he is the section editor for orthopedic surgery for a reputed Indian journal called The Indian Practitioner. He contributes regularly to academics in orthopedic surgery. Apart from local practitioner and association and Indian Medical Association, he is an active member of Bombay Orthopedic Society, Indian Society of Hip and Knee Surgeons, Indian Orthoplasty Association. In his busy schedule covering patient care, fracture, hip and knee replacement, spine surgeries, ligament reconstruction, and so on. He is an also active Rotarian. He is a member of Rotary Club of Mumbai Coastline. He organizes and conducts medical camps for his home club and offers his expertise and skills in medical camps of other Rotary clubs. His camps include various subjects, including preventive treatment of osteoporosis, mainly in women, informing on fall prevention that reduce incidence of fracture in elderly every year in leading to less stressful life. And that's it about Dr. Agarwal. And we are here with Dr. Shilpa Bansal Chavan, who is a clinical consultant, and she runs a multi-specialist clinic in Mumbai. We welcome you, Dr. Pranav Agarwal ji, on our platform. And to begin with,
thank you so much, Madam Director and Madam Moderator, for having me on board amidst some of the leading entrepreneurs of our country, all of them who are women, and everyone who is listening into us. Let's have a lovely discussion this evening. Shilpa Madam, lead on.
So before Dr. Shilpa begins, I would like to know how you started off with your journey in brief, and what makes you so motivated and keep you energetic throughout being you doing a lot of things in your day-to-day schedule. So what keeps you activated?
Well, I'm going to say two things. This is a very touchy topic as to how I ended up coming into orthopedic surgery. So I was very young, and I was just finishing my 9th or 10th standard, and a very close relative of mine happened to have an ankle injury, and this relative was operated upon by one orthopedic surgeon called Dr. Suhas Kate. He is a very prominent orthopedic surgeon in our area. He's in Andheri East. So I saw him treat my relative, and I said, boss, this is what I want to do. That's it. And that's where I started. That was probably in the 9th or 10th standard. And then I haven't looked back. So I went into medicine to be an orthopedic surgeon. And here I am. I'm an orthopedic surgeon, a super specialist in knee and hip surgery. As to what keeps me motivated, so, in medicine, the training that we undergo in our postgraduate and in our undergraduate days is almost like military. So, there was one time when one of my colleagues was down with fever, 101 degrees fever. So he didn't come to the operation theater. The boss was operating. So he says, no, you call him. So I went and fetched my senior colleague, and he came into the operation theater and told my teacher, sir, I'm unwell. I have 101 degrees fever, so I cannot come for the surgery today. So my teacher said, boss, this man who's lying on the table has got 3 fractures in his legs. He cannot walk. Is your problem bigger or is his problem bigger? So the patient's problem is bigger. Leave everything, have a crocin, and wash up for surgery. That's what keeps us going. In the end, our patients walk, our patients do well, our patients thank us, and irrespective of what happens, this is the best pleasure that a surgeon can get. He needs to hear his patients are doing well. That's what keeps us going. That's what I get up every day morning and go to work to do. So that's how I'm here.
Fantastic, doctor. That's
Thank you.
We all have seen, in fact the world has seen during
Yes.
COVID times how you guys just didn't cared about your life, and you just kept on giving to the society well-being, and you helped us having our good faith, good health. So
And we
over to you,
will
Dr.
always
Sharma.
be there. We will continue to be there.
Thank you so much for that
Yes.
faith and that words and that kind of help you extending to the society. Over to
Yes.
you, Dr. Shilpam. Kindly take the session ahead. Thank you so much.
Thanks, Dr. Mamta, for the beautiful introduction, those questions, and the beautiful invite. So fine. So, hello and a warm welcome, Dr. Pranav. And as diving into the subject, let's talk about it. So, the first thing is, as you rightly said, we all got to salute and have gratitude to all our fellow doctors and what we call ourselves frontline warriors. And just to mention a bit, on the 1st of July, Doctors' Day, we did have a conference being a non-medical platform to pay gratitude to all the doctors of different streams. Okay, so thanks, Dr. Pranav, to be here. And yeah, so we begin. And my first question, as you say, you're dealing with all the women issues right now here. So
Yes.
what is very common, what we find, they say, doctor, हमको तो osteoporosis हो गया है, पता नहीं अब क्या कर रहे हैं हम. So what is osteoporosis, and why do women suffer so much from osteoporosis?
Yes. See, osteoporosis in simple translation means weakness of bones. Bone has got 2 constituents. One is the cell matrix, which is the biological component of bone, and the other part is calcium. So bone is made of natural cells. There is a matrix of cells, and then there is calcium inside it. So when we are young, our bone is soft. When we go into adulthood, it becomes very, very strong. Strong enough that we can indulge in so many other activities, including sports, including heavy activities, labor, etc. Suppose we did not have bones, then we would have been a blob of bag of cloth, because we will jelly.
Tissue.
We would be jelly. So
Yeah.
what is it that does not make us jelly? What is it that makes us walk, makes us rise up, makes us climb, makes us fly in an aircraft? It's the bones. With age, with usage, bone starts becoming softer. It is the strongest in young adults, and through from 18 years onwards until 45, 50 years on. Then it starts becoming slowly soft because the body's capability of depositing calcium into the bone starts becoming less and less. That's why the bone starts becoming soft. This is osteoporosis. It is an age-related problem. It means weakness of bones. Why is it common in women? Is because women have certain hormones which are very different from men. Okay, they've got estrogen and progesterone as compared to men who have testosterone. So the testosterone inherently helps men have stronger bones, whereas estrogen and progesterone, which women regularly have, that causes a little weakness of bones when they are slow in production. And when they become slow in production, they become slow in production during menopause. Menopause is the time when a lady's reproductive cycle is coming to an end. After that, these hormones decrease, and because of decrease in levels of these hormones, they face osteoporosis more often. It's not that osteoporosis only affects women. No, it affects men as well, but it affects women much faster and much more seriously. For example, if you see a young woman, she'll be standing straight, she'll be athletic, she'll be everything. The moment she becomes a little older around menopause, she stoops a little. And if you see our elderly ajis, they are fairly stooped, because what happens is all those bones become soft, and that causes deformity. That's why they become that way. So osteoporosis is weakness of bones. It affects women more. It does not affect women only. That's what osteoporosis is all about.
Fine. So, in
I
short,
hope
what
that
you
answers
meant
your
was that
question.
yeah, sure. So, if I moderate it, it says it would be that it's a condition in which the bone becomes brittle and fragile because of loss of tissue due to the hormonal changes or deficiency of calcium and vitamin D. So, as we
That's
know
correct.
that it is osteoporosis. So, can we treat it?
Yes,
Can we treat
absolutely.
it properly?
Absolutely. And let me put it to our August audience today that late last year we have put in an 11,000 word article in a very reputed journal about the clinical management of osteoporosis in orthopedics. And let me put it very clearly that osteoporosis is treatable. And the treatment for osteoporosis is oral medications. It is not surgery. Osteoporosis is weakness of bones. What happens is that the calcium starts decreasing, calcium content starts decreasing in the bone. So, what we do is we give medications which take calcium from the blood and put it back into bone. At that time, we also give these patients a lot of calcium so that there is enough calcium in the blood to be put back into bone in the first place. So it is absolutely treatable. And once you treat osteoporosis, if you treat weakness of bones, it is going to prevent fractures. What happens is, suppose me, Mamta ji, or Shilpa
Yes.
ji, one of us fall down at home because of slippery floor, we will probably just get a bruise. But if my grandmother falls down at home, she might get a big fracture. If she gets a big fracture, then it entails surgery, it entails blood transfusion, it entails bad quality of life. But if she had
Correct.
received treatment for osteoporosis and her bones were not as brittle as they were, then probably that fall would also have given her bruise. So, osteoporosis is completely treatable through oral or injectable medications. And the advantage to that is that it prevents large fractures, morbidity, and such things. Osteoporosis in itself does not have any symptoms. So, yes, the answer is
So,
we can treat osteoporosis. We can orally, medications, not surgery.
yeah. Fine. So once we know that osteoporosis is treatable, let us all inform the August audience that osteoporosis is treatable with medication alone, and it is
Yes,
almost like you got to take it for a longer time. It's
yes,
like continuation for a longer
there
time.
are stipulated periods of how much you need to take medication based on something called as a DEXA scan. I believe Shilpa madam already has a question on DEXA scan, so we'll come to
Yes,
that
yes, yes.
point.
Please go ahead.
So
Okay,
how
you
does
want to
one?
speak it now?
Yes, let's just take it up right away. So how does
Yeah.
one know whether I have osteoporosis or not? How does one determine? Because osteoporosis has no symptoms. Suppose you have a migraine.
Yes.
So you say, I have a headache. You go to the doctor, they do some tests and then say, no, this is a migraine. Suppose you have blood pressure, you will feel, suppose you have diabetes, you will feel that, yes, I need to go to the washroom 2 3 times in the night. I continuously feel thirst. I continuously feel that way. So that leads us to thinking that there could be diabetes. But unlike this, in osteoporosis, there is no symptom. You will not feel pain, you will not feel anything. But the bone is becoming weaker because there is menopause, because there is decrease in hormonal level. Therefore, you need to, after a certain period, especially in women after menopause, once in a while, you need to get this osteoporosis checked, either from your physician or from your orthopedic surgeon. And how do you check this? There are two things. One is blood test, and one is something called as a DXA scan. DEXA scan. Blood test will look at your calcium levels and your vitamin D levels and your vitamin B12 levels. This is a simple blood test, just one prick. And DEXA scan, which is also called as BMD, bone mineralodensitometry. That is a test
Okay.
which we use to assess the strength of bones. It is like a CT scan, but it has no harmful rays. Unlike a CT scan, it has no harmful rays. It does not require any
Okay.
preparation. It does not require any puncture or injection. It is a simple scan.
Okay.
That is what we recommend. The scan happens in 30-40 minutes. The result comes, and according to the result, we treat that osteoporosis. So DEXA scan is a very simple, non-invasive test, which I recommend that once menopause has happened, once a few years past menopause, you can do it once in 3 years. If there's osteoporosis can be treated to prevent further problems which arise out of osteoporosis. That is what a DEXA scan is. And believe me, there are so many organizations. We also do that. That there is that small machine. The people come with that
Yes.
small machine, and you put your foot onto that machine, BMD machine, and it gives you a score.
Yes.
That is
Yes.
not the correct. That is not the correct final test. That is a screening test. So you really need to undergo that CT scan jaisa machine, the DEXA machine, that test before you can start oral therapy for osteoporosis. So that is what a
But at
DEXA
least
scan
that T
is.
score gives. Yeah. So fine, that T score which you mentioned on that
Yes,
machine, at least it's a
yes,
screening test. It gives an indication that okay, if the score
yes,
is minus or if it is
yes,
less than zero, then at least
yes,
it says that you have some start with osteoporosis, and then you can
yes.
go ahead with the DEXA scan, know it perfectly, and go ahead with the
That's
treatment with the surgery.
that's
Yes,
that's bang on.
that's
That's
very
correct. So as Shilpa madam would know,
yeah.
that there is a difference between a screening test and a diagnostic test. A screening test is when you
Yes.
have a group of 100 people, you screen very fast. Out of that, you isolate 15 people who have a T score from that small test. Then you subject these 15 people to the main scan. And that's when you understand
Correct.
that out of that, 4 people have been diagnosed that osteoporosis, and then you treat the osteoporosis. Yes,
Fine.
that's correct.
And one as a very important thing, what you said was that we should suggest as a treatment the calcium tablets. So, as a dietitian, I would also suggest that they can go in for a calcium-rich diet,
By all
right?
means, absolutely, absolutely,
So, I will just
absolutely.
mention a few things which
Hmm.
the calcium-rich plants foods in India. It could be
Yes,
almonds. It could be
yes,
different type of dals, urad dal, the ragi, the sesame, then the rajma, the moong, then also the chana, then the tofu, that is soya paneer, and the
yes,
different curry leaves, the fenugreek leaves, the beetle leaves, the radish leaves, and the dry fruits like dry figs or even poppy seeds and flax seeds. So these are a
yes.
few things from our daily diet which can also be given along with the nutritional supplements or the oral therapy which we would like, so that there is better bioavailability of calcium in the body, and so that the things are taken care of well.
I agree
Fine.
with you.
Now,
I agree with you on that point, Shilpa madam. And just to add to that, sometimes,
yeah,
very anxious parents come to me with their 13-year-olds and 15-year-olds who are very nice football players, who are very nice sports people in their school. And they come and tell me they are anxious parents. They care about their children. So they say, Doctor, don't you think we need to give calcium supplement to my child? And at that time, I say that, it is not necessary. If these children have a healthy, nutritious diet, like Shilpa madam mentioned, these children, young ladies, they don't require calcium tablets. They don't require treatment of osteoporosis. All this happens in a later stage, unless there is another problem. There are certain medical problems like diabetes, blood pressure, some rheumatoid arthritis, and such things which cause osteoporosis amongst ladies and amongst men also. For them, we may recommend, but for younger people, no, there is no need for calcium supplementation and such. They are healthy adult diet, healthy nutritious diet, and खेलने दो यार, sun में जाने दो उनको, let
yes,
them play football, let them enjoy. There's no need for taking pills at 13 years and 18 years of age.
right, right. That's very correct.
Agreed.
And from your
Agreed.
talk of football, I come to this point that what is a
Yes.
ligament tear? Because I think that is something
Ah,
which is very common with footballers.
yes. So a ligament inherently is a tight structure which binds two bones. Okay, so suppose this is your knee, this is your bone of the thigh, this is the bone of the leg. Okay, and movement happens at that. That is called a joint. So our knee is also a joint, and that's what helps us get up. That's what helps us move, sit, climb stairs, play, hop, do whatever. So all movement in our body happens at the joint. Now these structures, ligaments, these are very tight structures which keep the joint together. Okay, it's because these ligaments are there between these two bones. That's why the bone stays in its integrity as a joint, and that's why it doesn't slip off continuously. Okay, it does not slip off continuously. It stays like that. Why? Because there is a ligament cover around it. So similarly, there are various types of ligaments in various joints of the body. When we are playing football, when there is an inversion injury of the ankle, sometimes you see some of these best players, they are running, they suddenly turn and pop. They fall, they are in tremendous pain. The physio has to come in. Sometimes they have to be put on a stretcher. Why? Because some of these crucial ligaments, which help maintain the integrity of the joint, they are broken. And that is what is a ligament injury. So basically, there is no fracture. Bone has not broken, but the ligament has torn. If the ligament is torn, suppose there are 2-3 ligaments which are holding that joint tight. If the ligament is torn, then the joint opens up like this from the side, which it should not open. The movement should be only in this direction. But idhar ka ligament toot gaya hai, therefore it is opening up like this. And if it opens like that, then we are in deep trouble because the joint is not stable anymore. So when there is a ligament injury, that needs to be dealt with generally by surgery. And in surgery, we have these days minimally invasive methods of surgery. So, the diameter of that scope is as thin as this pen. इतने में हम अंदर जाते हैं, two such holes, and we sometimes reconstruct the full ligament of the knee, and the patient can go back to active sporting, competitive sporting, just through this much surgery. And that is what a ligament is. So bones, ligaments, menisci, all these are structures of the bone and joint which are very, very important. When they work well, you can be a real good athlete. When they don't work well, just one of them does not work well, and your sports career can be finished. So that's what we do in ligament injuries. And these are beautiful surgeries. People go back to national level and international level sporting as well.
So we should thank all the orthopedics with their arthroscopes so that these ligament things can be repaired off so nicely. So basically, I would say that ligament...
We do our bit, but everything else is the healing and everything is upar wala. We just help bring it back to normal.
It is good to believe. It is good to know that doctors also believe in God. It's good to know that.
We don't believe. We fight with him. We fight with him every day.
Yeah, and that is because we are his good agents. That we want things to be. That is right. And one thing.
No.
And what I want to drive home was
every day God says that this patient is mine, and I said no, not today.
Some other day. Fine.
Other day.
Yes. One thing what I wanted to point out was that easily a fracture can be diagnosed with an X-ray. But if you talk about ligament tear, X-ray will never help, and it has to be a scan, or you have to go to the orthopedic surgeon to get the things right. Right? Is it correct, Dr. Pranav?
That is correct. See, we have four basic modalities of testing in orthopedics. One is X-ray. It's a simple X-ray. Second thing is ultrasound, sonography. Okay. In modern times, people are doing very well at using sonography for understanding ligament injuries. That's second. The third thing is a CT scan. So a CT scan is, let's say, just a powerful version of an X-ray. It is just the king of X-ray. So if I want a more detailed X-ray, I might suggest a CT scan. And the last thing is something called as MRI, magnetic resonance imaging. Magnetic resonance imaging is very, very crucial in understanding soft tissue injuries, in understanding soft tissue problems. So an X-ray will show us only bone and bone-related problems, whereas MRI will show us a lot of detail about ligaments, about meniscal injuries, about cartilaginous injuries. So when there is a soft tissue injury, suppose a person who is a football player or who is an avid trekker or a gymmer or just a homemaker, a lady who was out to get her son from school and she twisted her ankle on the road while she was on the road on an uneven surface. Bombay roads are very nice. So she was just she twisted her ankle and she came to me. I got an X-ray done. On the X-ray, there is no fracture yet. There is a big watermelon sort of swelling over there in the ankle. At that time, I might recommend an MRI scan because if there is no fracture, then it is more likely that a ligament has avulsed, a ligament has pulled. And there are various ways of treatment. So this young lady who is a mother of a 4-year-old or a 10-year-old, if she has one ligament injury, now ligament injury can be of three types. It's either just a pull, it's either a partial tear, or it's a complete tear. So if it's a crucial ligament which has had a complete tear, then we come to surgery. If it's a small one of three ligaments which has just pulled, then the answer is sometimes only a crepe bandage. So there are a lot of patients who worry कि अरे डॉक्टर ने MRI बोला इसका मतलब कुछ तो बहुत बड़ा है. जरूरी नहीं है. It's not always true. It means that we are looking for a definitive diagnosis to understand how to treat. Only 30% of patients with ligament injuries will ever require surgery. So diagnosis is prime. When we do the MRI, we know which ligament is injured, how bad it is injured, and what can we do for it.
Exactly. So that diagnostic part is what I wanted you to emphasize, so the people are clear as to what they should go for, and once they go for what they are supposed to look for, and that is how they can go ahead.
Let me put it clearly. In orthopedics, there are hardly any invasive diagnostic procedures. So most of our diagnostic procedures, most of the tests that we say will not involve even a single injection. So it's very simple. There are no tests which involve injections. And once a test is done, very rarely do you require surgery in terms of ligaments. So you should not be afraid of diagnosis. Many patients feel कि अरे MRI spine मेरे को backache है, डॉक्टर ने MRI बोला इसका मतलब आज तो कटना है. No, it's not always that way. It's not always that way. Just because you have backache does not mean you need surgery.
Yes. This all preconceived ideas in the patient are because of the Google, encyclopedia, WhatsApp encyclopedia, and the infodemic, which goes around with a lot of misinformation.
Right.
Misinformation. I emphasize misinformation.
If you look at Google,
Right.
the answer to all problems is cancer.
Yes, and as they read through it, they say, "मुझे ये भी है, मुझे ये भी है, मुझे ये भी है." Everything is there with them.
There are two problems. One is Google, and one is that particular neighbor who never made it well after surgery. एक ऐसा तो neighbor होता ही है. एक तो ऐसी चाची जी होती ही हैं जिनका ऑपरेशन हुआ और वो कभी नहीं उठे. तो ये चाची जी का बिल्कुल भरोसा नहीं कीजिए.
Because there are so many factors that why that chachi has not got up from the bed. There could be so many factors which they are not aware, but they blame it to that some major thing what has happened with them.
Yeah,
right.
Indeed.
So from this, I think we can go to this another common problem of chachi, and that is that knee joint pain.
Yes.
So the knee joint pain, and they say कि हमको osteoarthritis हो गया.
Yes.
और हमको डॉक्टर साहब ने बोला है वजन कम करो. Now,
yes.
How to deal with all this? And
so
what is it?
Let me first clear a very simple doubt, Shilpa ji. Osteoporosis and osteoarthritis, these are two different things. Oftentimes, people confuse these to be the same. So when they have pain in the knee, when they have crooked knees, elderly grandmothers sometimes have crooked knees because there is osteoarthritis. There is osteoporosis as well. But osteoarthritis is the condition in which the cartilage which is there between the two joints gets eroded. That is an age-related problem. It happens in most of us when we age. What happens is कि दोनों हड्डियों पर एक cartilage होती है. Cartilage is like the gaddi. In common language, we call it gaddi. It's like the grip of a cricket bat. It's soft. It helps the bone move,
Yeah.
right? So that starts getting eroded with age. Once that gets eroded, the bone starts rubbing against bone, and there becomes deformity, not just in frontal plane but in side plane also. Because of this, there is pain. The patient walks as a dole ke chalte hain. They rock when they walk. So you see
Yes.
elderly ladies, they walk like that. That's because the knees are not straight. They lose all the strength in the knees, and that's called osteoarthritis. It happens in the hip also. It happens in the ankle also. In Western world, it happens more commonly in the hip. In Indian world, it happens more commonly in the knees because we sit cross-legged, palti maar ke baithte hain. So that's the reason why we get osteoarthritis more commonly. And osteoporosis, which we talked in the beginning, is not the
Yeah.
cause of this pain. Like we said, osteoporosis has no symptoms. There is no pain.
Mm.
So this is caused
Yeah.
because of osteoarthritis. And osteoarthritis में वो cartilage एक बार जो घिस जाए, so then it is impossible for us to regrow that cartilage because cartilage has no blood supply. So we cannot reach medication to the cartilage because it does not go via blood because there is no blood supply. So once this cartilage is lost and bone is rubbing against bone, when there is pain, when you cannot get up and run, imagine a grandmother sitting with her granddaughter. Okay, शाम को आराम से बैठकर टीवी देख रहे हैं, their favorite serial, and dad comes home. बच्ची के dad comes home, he rings the bell. The little girl is going to jump and run to the door, open the door, give her dad her hug, and come back to the grandmother. इतना टाइम तो दादी माँ को उठने को लग जाएगा.
Correct.
It takes as much
Yes.
time for the grandmother to get up what it takes for this young girl to dart to the door, give her dad a hug, and come back. Why? Because there is a lot of pain in the knees. Why? Because she's not being able to get up so easily. This is happening because of osteoarthritis.
Okay.
And once this
So,
cartilage is lost,
is it?
then we have to do surgery.
Yes.
Yes. Yes. There are
So
various ways
surgery
of
is the
treating
only answer.
osteoarthritis. No, surgery is not the only answer. So there are various grades of osteoarthritis. In a younger person, say grade 1 or grade 2 hai, so we give medications, we give physiotherapy to strengthen all the bones around, all the muscles around the knee, which help the knee stay strong. We tell them to have an
Okay.
active lifestyle. We tell them to do this. This is stage 1. If that doesn't work, once the osteoarthritis progresses, then we give intra-articular injections, which means there is an injection which goes inside the knee, which mimics the fluid of the knee, and it gives a lot of relief. And once this also doesn't work, when it is a terminal stage, जब ये बहुत टेढ़ा हो गया है knee, when the cartilage is really lost, that's when we suggest surgery. That is also the time when the patient is most likely to benefit from surgery. So surgery is always, in my practice especially, surgery is generally the last resort when I feel that surgery is really going to benefit the patient. Till then, we don't recommend surgery. So it is a common fear. Ki I have pain in the knees, I go to the doctor, he is going to replace the knee. No, not always. Not always. There are 3 stages in that also, and we adhere to that. Because the patient should also feel
So-
benefit of this.
Yes, definitely. So once the person reaches a stage of undergoing surgery, and
Yes.
the person has undergone surgery, so even after that, if physiotherapy, medication is all that they should continue for a time, because what is usually seen that usually when the patients go in for surgery, they have got their knees replaced and they think everything is going to be as normal as it was before. Obviously, it will take time, but that is the part which they don't understand.
Yes.
Could you just
So I'll tell
explain
you.
a bit?
Yes, I'll tell you one thing. These days, knee replacement surgery comes with so much power of technology and so much understanding of the disease that it's a very fast procedure. Okay, it's something like cataract used to be once upon a time. So it's very fast. We are
Okay.
very safe. We know the problem very well, and we deal with the problem very well. These days, a patient will get admitted today. We will operate tomorrow. The same day, patient gets up and walks on that knee. The next day, we encourage the patient to use the washroom. The third day, if all is well, we discharge the patient to go home. The patient can go home, fetch a glass of water, perhaps make tea, do everything. So it's very easy these days. And most of these people are back to traveling to work within 15 to 20 days. Yes, it requires a little bit of physiotherapy, not bad,
Yeah.
painful sessions in a physiotherapy clinic. No, we generally teach our patients some simple exercises, and that's it. They do that, and in fact, we encourage them to go back to work or go back to their social life, go back to their routine home based life sooner. And people send us pictures of dancing in their grandchildren's parties and climbing up big steps of buses and helicopters and such. So they are very happy. They go back to sometimes rock climbing. I have seen senior male patients who've gone back to trekking and such. So technology
Oh,
is
that's
very good.
great.
Pain stays definitely under control. We use computers to align the knee absolutely straight, and it's a beautiful procedure. I feel it's a beautiful procedure when done in the correct knee. And patient selection is our job that we do.
That's fantastic. So, having known that with the new robotic and automatic surgery, which you all do
Yes,
it so well, and if the convalescence period is cut down and people go back to work pretty fast, that's indeed
yes,
commendable. Yes.
yes.
But some of these patients have this habit that I have been told to lose weight. So, is it okay to lose weight, or is it essential, or does it just thought during
Uh,
osteoarthritis?
when we speak about weight, okay, we should speak about something called as obesity. Okay,
Okay.
uh, I am a human being. I have bones. I have organs inside my body. I have so many things that has weight. So a human being is going to weigh something. When the weight of that body is much more than the correct height of the body, that's when we call it
Right.
obesity. That is the weight
Right.
which is not correct. Weight loss does
Okay.
not mean size zero. Let me put it very clearly.
Yeah, yeah, of course.
Weight loss does not mean
Yes.
size zero. Weight loss means to be in the correct weight zone, which according to your height, which is called as BMI, body mass index. It's a simple calculation. It's available on Google, and you know exactly what to do, right? So
Yes.
if you decrease when you are obese, there are many problems that come with obesity, not just bones. So there will be heart, there will be
Right.
kidney, there will be so many other
Everything.
problems, so many other malfunctions, right? But in terms of
Yeah.
bones, yes, obesity is a problem. So if you are obese, there is a problem. If you cut down 1 kilogram of weight from your body, you will remove equivalent of 6 kilograms each from each knee. That is the
Wow.
equation. You are cutting down 1 kilogram of weight from your body, and that is taking away 6 kilograms from each knee. And therefore, I encourage that if you are slightly overweight, I know it is difficult. It is difficult to lose weight. It is difficult to lose weight. But if you can do that 1 kilogram at a time, you are really blessing your knees with or without surgery, with or without problem. Even if you are a young
Wow.
person, if you're a young lady with a job, with a family to take care of, if you're obese, it's not the best. If you decrease it, yes, it will definitely help. And I consider four things for decreasing weight. One thing is medical problem. If there is diabetes, if there is blood pressure, if there is thyroid, you control these problems and automatically weight gets controlled. That's one. We leave that apart. So how do I get rid of weight? It's a big problem, isn't it? Everyone has that problem. There are three prongs approach. One, as Shilpa madam would put it, diet. Diet, yes.
Yes.
Second, exercise. Yes, diet
Yes.
and exercise go hand in hand. They cannot work without each other. And the third thing is
Correct.
motivation. If you have diet,
Yes.
exercise, and motivation, and you can lose weight. You can lose weight. You should. If you are obese, not if you have normal weight. You cannot lose weight because you have to fit into that awesome dress. No, you have to lose weight because you are obese.
Yes. So that tripod stand is correct for losing
Yes,
weight, and that should be right. Okay.
yes,
So from this, I come to another question. That
yes,
apart from osteoporosis, osteoarthritis, ligament tears, and all, I mean, what could be
yes.
the other common causes of backache in women?
Okay. Backache has various causes. So we generally classify backache into groups of causes. The first and the commonest cause is mechanical. Most patients come to me and say, Doctor, 2, 3 days ago, I was absolutely fine. एंड 2 दिन से जो है मैं उठ भी नहीं पा रही हूँ, मैं उठ भी नहीं पा रहा हूँ फ्रॉम द बेड. इट्स वेरी डिफिकल्ट टू टर्न ऑल्सो. शायद सोने में कुछ आ गया है. That's correct. That's correct. That's a mechanical cause. What has happened is all those muscles around the back have gone into tight spasm, and that has caused it. Bad pillow, change of bed, some certain exercise that you started or changed, some sporting that you did, that is going to cause a backache. That is mechanical spasm of those tight muscles which hold your back up. We are biped. We walk on 2 legs. We don't walk like other animals on 4 legs. So why can we walk on two
Yeah.
legs? Because our muscles of the back hold us straight, right? So those muscles
Right.
are under continuous strain because we walk, we run, we hop, jump, we gym, we play sports, we take care, we pick up our children, we do so many things, right? So that's the reason why
Right.
these muscles go into spasm. It's mechanical. That's one.
Yeah.
Second thing is when you have the bones of the spine, हड्डियां जो होती है, these are square bones. Between these
Yeah.
square bones is something called as a disc, intervertebral disc. When this
Yeah.
soft
The
disc comes out and presses on the nerve, in common language we call it slip disc, right? So slip
correct.
disc is a
Yeah.
disc which is going and pressing on a certain nerve. When it is pressing on the nerve of sciatic nerve, it is called sciatica, right? So then you have that
Correct.
typical plane which is going in the back of your thigh, going all the way to your toes, and it's causing tingling and numbness and such
Yes.
things.
Yes.
This is a
Right.
this is a disc related cause. And then you have
Correct.
some very fearsome causes like tuberculosis and cancer and rheumatoid arthritis. Some of these causes are there. These are grave medical causes which require grave medical and surgical attention. But that's not what
Right.
90% of us get. 90% of us get these problems because of mechanical and slip disc related causes. So sometimes
Right.
having good postures, not bending down and picking up something heavy, on the contrary, crouching and picking up something heavy, keeping a pillow between your thighs when you sleep on the side, keeping a pillow between your knees when you sleep straight, taking a break every 35 minutes that you sit in front of a laptop, keeping a pillow behind your lower back. Like right now, also, I'm sitting with a pillow behind my laptop, behind my back when I'm focusing into a laptop. These are the simple things that you can do.
Correct.
These are posture changes which go a long way in one, taking care of a pain, and two, preventing this pain from coming again and again. So most of the times it is mechanical. And most of the time, mechanical causes do not require extensive investigations. If you come with a mechanical cause, 2 दिन से डॉक्टर दर्द हो रहा है, बच्चे को उठा लिया था, I am not going to recommend an MRI scan. No, you rest, you take medications, you apply ointment, you apply heat, and it settles down.
Right.
There is a young gentleman comes to me, doc, I was picking up something heavy in the gym, चालू हो गया और अभी मेरे को पूरा I am getting pain along my thigh. Even then, in the beginning, I don't recommend an MRI directly. On the contrary, I give some medications, rest. Eventually, if this problem does not settle over a good period of time, if it is bothering, if there is pain along the toes, if there is numbness, जिसको हम झुंझुनाहट बोलते हैं, if that is there, if there is weakness in the movement of toes, that's when we will recommend an MRI scan. And if there is a compression on the nerve, then we will go through that entire process. First physiotherapy, then injection, and then surgery. And many a times, trust me, surgery helps very well. These days, young corporate executives, and since I'm addressing WEICI, young corporate executives who are very much on the go, who cannot afford to take breaks from their corporate responsibilities, they come to me 30-32
Right.
something, marathon भाग रहा था, pain हो गया back में, there is a big disc, doc, do whatever you have to do, but I have to get back to work in 3 days. We do minimally invasive spine surgery, and this gentleman does get back to work in 3 or 4 days. They want faster
Wow.
answers, surgical answers, and we want to go back. These days it is minimally invasive surgery. 1 इंच का incision होता है, उसमें हम डिस्क निकाल देते हैं. पेशेंट चलने लगते हैं सेम डे.
Wow.
मेरे को तो सेम डे दे आर स्टिल ऑन IV and they are replying to emails on their laptop. So technology has
Wow.
come
That's
far,
great.
and it requires only 30% will require. So don't be afraid always that everything does not end in surgery, even though you are talking to a very specialized surgeon.
Because he's the one who's going to take the right decision. That is why
Yes,
he's specialized. He's
yes,
not going to
yes,
push everybody into surgery.
No,
Because
it's
I'm
not
sure he
necessary.
believes in. Yeah,
Absolutely, it
because
is not
it is
necessary.
something in his philosophy. He says, "Arogyam sarva dravyai sarvada." That is
Yes,
what his
that's correct.
philosophy is, in which he
Health,
says, "Health in
yes,
all forms, ever and always." Right?
yes,
Yeah. But
yes, that's correct.
before that, I have a small question which you can finish up fast, and that is a frozen shoulder, which is also very common. So could you
Yes.
just help us identify that, and what people should do about it?
See, our shoulder is a ball and socket joint. I don't know if all of you all understand what I say. It's a ball and there is a socket. Okay, it's a ball and socket joint. Our hip is a ball and socket joint where the socket is big. इतना बड़ा socket है hip का. Okay, so ball is
Yes.
safe inside the socket. वो बार बार बाहर नहीं आता है. Okay, in the
Yes.
shoulder, the socket is very shallow. The socket is like this, and
Okay.
this is the shoulder. The ball moves around inside a shallow socket. It's like a golf ball on a peg appearance. So, what makes the shoulder so
Okay.
stable? If there is no coverage to the shoulder, it is this entire group of muscles and ligaments and capsules, what we call as a rotator cuff, shoulder cuff tear, जिसमें कुछ patients में होता है. So this is a rotator cuff. It makes the shoulder very stable, and the reason why this is small, this is shallow, is because it affords full movement to the shoulder. अपना shoulder पूरा 180 degrees ऊपर जाता है, अपना hip इतना ऊपर नहीं जाता है, वो सिर्फ ballet dancers में
Right.
जाता है. Okay, so our
Yeah.
hip does not go all the way up, our shoulder does go all the way up because it is stabilized by this rotator cuff. In frozen shoulder, what happens is that cuff becomes tight around the shoulder. It is also called adhesive capsulitis. Adhesive means gum jaisa, फेविकॉल जैसा, and capsulitis
Yeah.
means capsule उसके आजू बाजू tight हो जाती है. So it becomes tight.
Correct.
Now, the most important thing that I would like to tell you on this forum today is that frozen shoulder is a self-remitting disease. It is a self-remitting
Acha.
disease. Self-remitting means it comes by itself and it goes away by itself. Nothing that you eat, nothing that you take medication, nothing surgery that you can do can make the frozen shoulder go away. Frozen shoulder comes, it goes away by itself. Sometimes it lasts 6 months, sometimes it can last 1.5 years. And when it lasts, it causes stiffness. So, what we need to do is we need to do physiotherapy to prevent this stiffness from coming and prevent this stiffness from staying once the problem has gone away. There are some people जिनका frozen shoulder इतना tight हो जाता है कि they cannot move their arm 20 degrees also. For such patients,
Yes.
then we give them general anesthesia and we help them move that shoulder in the operation theater. It's called manipulation under general anesthesia. वो पूरा हम चला कर देते हैं, उसके अंदर adhesions break कर देते हैं, और उसके बाद में भी the patient has to have physiotherapy to keep that shoulder moving and not get stiff when the frozen shoulder problem goes away. It's very common in patients who have diabetes and thyroid.
Right.
So it's not something to worry about. It comes, it goes away. If it's very tight, we can help you.
Right. So that's fantastic information, Dr. Pranav. And you've been really giving us pearls of information regarding all the queries we have put forward to you. And I have a lot of queries, but then it would be, endless. So I think with these comments, I would like to thank you for being here and clarifying our doubts and, giving us pearls of knowledge and information about the things and the common problems which we all women face as such. So thank you so much, Dr. Pranav. Thank you.
Thank you, Madam Director and Madam Moderator, for having me over with you all, for giving me the opportunity to interact with such an august audience. These are women entrepreneurs of our country. Our country now is not just known by the mother and the daughter, it is also known by the corporate head. And I really thank you for all the kind of entrepreneurship that you will lead our country in COVID times, away from COVID times. And as far as women's health issues are concerned, we are always there. We have your back, and you can always turn up to us, and we will definitely help out in whichever way we can, so that you can continue these entrepreneurship and these beautiful initiatives that you take. Thank you so much for having me.
Thank you so much,
Thank you
Dr.
so
Pranav, for enlightening us because, yes, these issues are pertaining not in these times, but these are like, age old issues. And
Yes,
every girl, when she grows up to another
yes,
phase in life,
yes,
these issues are gonna come because as a woman, we only believed in the fact that we need to serve to our family, unlikely to serve ourselves, love ourselves. So I think these are issues which which has built in due to our own lifestyle also, because as a mother, as a woman from a family, I always think first my husband, first my child, first my in-laws, and lastly when I think it's only me. But there I miss on my lifestyle, on eating, on having proper diet. But yes, with these all experiences, these all inputs what you have shared, we need to take care of our habits. We need to follow certain rules in life, considering the good diet, considering good exercise, and considering the
good
proper
health.
yes, of course, good health, but what proper screening, because yes, that would keep us uh, that would it would be an eye opener for where my body, where my health is going
yes,
ahead. So
yes.
that is something we all women should keep in mind. Yes, family, our kids, our everybody is on priority, but with that, we should never forget our health
And
also a
Mamta
priority.
ji, we must not forget that it is because of somebody like you and somebody like Shilpa ji and somebody like so many people in the audience, my mother, my wife. It's because of y'all that I am who I am where I am, and I'm talking to y'all as well. So there are sometimes, these ladies come to me and they say, "Okay, doctor, you will operate my knee. Who's going to make chapati and who's going to make tea for my children?" And I said that all your life you've taken care of them. Give them
Yeah.
few days to take care of you.
Yes.
Making tea is
Yes.
not very difficult, but it's
Yes.
important that you walk. It's important
Yes.
that you go down to fetch fresh vegetables. It's
Yes.
important that you be at the house when things are happening. People are coming for deliveries. People are coming and going. Men are working. That's all because of people like you. So I am who
Yes.
I am also because of women like you, and you all should take care of your health. Yes, and we are always there.
I think we have
Yes.
one question before we end the
Yes.
session. Um, this is from Bhavna, Dr. Bhavna Kucheria. She is a gynecologist. She's asking which calcium salt is better. Is it carbonate or is it citric?
Carbonate or citrate? Good evening, madam.
Yeah.
The thing is that it really does not matter as to which salt is used in the medication and in the delivery drug. The important thing is that whatever salt you use, there has to be certain amount of delivery of calcium into the body based on the age and requirement of the patient. For example, a healthy young adult lady will require about 1000 to 1200 milligrams of calcium requirement per day. So at that time, we suggest them, like Shilpa madam also said, some diet, some milk, nuts, etc. And if that is lacking, then we give calcium supplements. After a certain age, there are certain calcium supplements which regularly need to go in some of these elderly ladies. And it does not matter which salt you use. What you need to confirm from the pharma agency is uh, how much of elemental calcium does that medicine deliver inside the body. Accordingly, based on the requirement of this person, you need to give the calcium tablet. If calcium citrate maleate is delivering, say, 500 milligrams of elemental calcium to the body, then you require two such tablets for this person if the patient has osteoporosis, and you require just one such tablet if they have osteopenia, which is one step short of osteoporosis. So that's how you
Correct.
titrate and that's how you give. Every pharma company is going to tell you, madam, मेरा जो drug है इसमें से ज़्यादा calcium जाता है. No, you look at what they've written. You ask their representatives for representative papers for data publishing and see how much their tablet gives elemental calcium to the body. That's how you prescribe. That's how I prescribe.
Oh,
With
that's
that,
great.
I think
That's a
you
very
have
comprehensive.
You have made our evening today with so much information. And
Yes.
for me, who is coming from totally medical background, I think I had got a lot of information. I have enlightened. I have aware about the fact that these are the things. Maybe these recorded videos, which will when will go live, it would more create a lot of awareness, and
Yes.
it would help people to find the right solution for their
Yes.
problem.
Yes.
And thank you so much for your time, sir. And we're looking
Thank you.
forward for having you in future, so that we can keep on touching on such subjects and creating a lot of awareness among people. Because I think we are the knowledge bank which we should share with the people. Unlikely, they're looking for answers, but unfortunately, they're not
Yes.
getting the right
Yes.
information.
That is
So
correct. Sometimes there is so much information available, you don't know what to trust.
yes.
That is
So
correct.
thank you so much, and thank you, Dr.
Thank you.
Shilpa, for moderating today's session and helping us getting lots and lots of wisdom to our forum. Thank you so much, Doctor. Thank you so much.
Thank you for having me. Thank you. Thank you and good evening. Good evening.
Good evening.
Bye bye.
Thank you.